Let's get started here, everyone. Good morning, good afternoon, good evening. Thank you to all those who have joined us from around the world, actually, for this webinar titled uh, Driving Medication Safety in Community Pharmacies Through Continuous Quality Improvement. An introduction. My name is Ali Shahzada. I'm the Executive Director of the Value Collaborative, and my colleague here, Ina Ajla, is here, the Director of Community Pharmacy Reporting and Learning on behalf of ISMP Canada. Thank you again for making your time to uh, join us here today to talk a little bit about what is CQI and how you can actually apply this in a community pharmacy context. So we're going to start here with just a little bit of land acknowledgements. Want to recognize that we acknowledge that we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. Now, you may know that we are in Canada, and this land acknowledgement is in reference to the head offices of ISMP Canada and the Value Collaborative, which is Toronto, Ontario. If you feel like you want to recognize any Indigenous peoples from your area, please feel free to use the chat window and you can start to recognize people. Thank you so much. Let's keep going on. So, what are we hoping to achieve today? We are hoping to achieve a little bit of an introduction, give you a sense as to what is CQI, what is this general term of CQI, and what are Lean and Six Sigma within this approach. We also want to talk a little bit about what are some actual scenarios where this has been applied and how we've actually been able to utilize some of these skills in a community pharmacy context. And then we'll talk a little bit about if this is of interest to you, CQI, well, how can you actually start to make a culture of continuous improvement in your own organization? In terms of today, that kind of builds on what today's agenda is, what a little bit the introductions and why CQI is important right now. We'll talk a little bit about what these concepts of Lean Six Sigma are, how to approach the problems, what some real case studies are, and again, what are some components necessary to further this type of culture in your own organization. So I'm going to hand it off to Ina now to talk a little bit about who is ISMP. Ina.
Great. Thank you, Ali. Yeah, so a little bit about ISMP. We are a national not-for-profit organization. For over 20 years, we've been a trusted partner in strengthening medication safety through timely learning, sharing, and acting to improve healthcare. Most of our funding for operations comes from government or healthcare delivery organizations. Let's start a little bit about how we learning. Let's talk a little bit more about how we learn. We collect, aggregate, and analyze data on medication safety from practitioners like yourselves, consumers, caregivers, and others so that this knowledge can be translated to understand what issues and errors are occurring with medications and why. With this knowledge, we then develop and disseminate lessons learned with compelling, actionable, evidence-informed recommendations for reducing preventable harm from medications. This knowledge and expertise is then used to purposefully partner to implement, sustain, and evaluate medication safety improvements in practice. All of this work is done in collaboration with organizations, practitioners, consumers, and caregivers, and other partners across the healthcare system. Back to you, Ellie.
Thank you so much. The Value Collaborative, we are a consulting firm based in Toronto, Canada. And what we do is we like to partner with leaders like yourself in designing processes and systems that really drive quality improvement. How we do that is we have three major things that we work on. We partner with organizations and help facilitate problem solving on key strategic initiatives. Then we have training, things like today, or we have yellow belt and green belt level certification programs, also a variety of others. And strategy, partnering with organizations to see what are your 3 to 5 year strategic plan looking like and how we can actually make that more quality improvement focused. If you're interested in learning a little bit more about us or learning about our free webinars that we do from time to time, please feel free to use the QR code here and join our LinkedIn page. So that's a little bit about us. I would really like to know who's around the virtual room here today. In the chat window, we have quite a number of people here. So in the chat window, I would love for you to just tell us a little bit about who you are, what role you have, what organization you're representing, and most importantly, why did you register today? What were you hoping to get out of today? Is there something, a specific question perhaps that you were looking to answer? With that, I'm going to hand it off to Ina to talk a little bit about why CQI now. Ina.
That's a great question. So why now? With over 600 million prescriptions dispensed annually in Canada, medication safety translates directly to patient safety. Through analysis, we can say that unsafe medication practices and errors are a leading cause of avoidable, and I emphasize avoidable, patient harm that is estimated to have a global cost of $42 billion. So, in a 7-year study conducted by ISMP Canada in 2017, we identified over 131,000 events or reports from community pharmacies in Nova Scotia. Over 98,000 of those reports were quality related, but the good news is that 82% of those did not reach the patient. About 1% were associated with patient harm. That doesn't seem like a high number, I know, but it translates to 928 patients who experienced harm due to a medication error. Unsafe medication practices also impact families and caregivers, and it impacts time from the caregiver patient perspective, but also the pharmacy's perspective. The stress and frustration experienced by all involved and all impacted is significant and ultimately has financial implications for the community pharmacy, for patients, and for the overall healthcare system. Now, if we take a look at the bigger picture, let's look at 2023 data for the larger national picture. An analysis of the top 10 incident report types to the National Incident Data Repository, which comes from community pharmacies in Canada, for harm-related events reveals the top 3 types of incidents for over 12,000 reports. This means that just the top 3 types of incidents or medication errors were incorrect dose or frequency, incorrect quantity, and incorrect drug, which resulted in avoidable harm for more than 12,000 patients in Canada in 2023. This then translates to the greater impact of what we just talked about: time, frustration, stress. So the costs to the event are of course great, and the impact on the patient and their families and caregivers is very, very important. Next slide, please. So the complexity of processes in community pharmacies is increasing with changes in scope and added workload. I'm sure many of you can relate to that.
Okay, so let's fast forward here into what is quality improvement, because this is a big question that we all have and why you're here today. So quality improvement is a philosophy. It's all about trying to create a culture or a rhythm where we are continuously looking for better and better ways to reduce waste or improve quality in our own organizations. As I mentioned, it's a philosophy. It's not something that we just do once and then we hope sticks. This is an ongoing kind of initiative. So What CQI is a set of tools and an approach that looks to engage employees in finding better and better ways of working. It is not about making people just work harder and faster and just making life more difficult for people, spending less time with our patients, because that would be actually counterintuitive. That would actually reduce our quality. And what we're trying to do is improve it. So it's about finding the definition that we work with here is providing the maximum value to our staff, patients, otherwise our customers, with the safest minimum number of resources. Because resources are tight and we might not be able to, we can't continuously be spending a high number of resources. It's not very sustainable. So this approach of quality improvement or continuous quality improvement, consider this as a very big umbrella term. And there's a lot of different methodologies within that. Two of the most dominant approaches are Lean and Six Sigma. Lean is all about trying to improve flow. So picture a stream, water stream, and the more garbage you put in that stream, the slower the flow becomes. That's just what we're trying to do with Lean, is using a set of tools to look at a process and see how it flows and remove the garbage from it, the waste in those processes. Six Sigma, slightly different. Six Sigma is all about reducing variation and saying, why is it that one day our processes work this way and another day our processes work another way? We want to make more consistency in our processes. And so Lean and Six Sigma have fused over the course of many years, started to fuse together to become one single approach, Lean Six Sigma, a set of tools that we can borrow from both. And the idea here is to apply this thinking in improving our quality. As I mentioned, Lean focuses on waste, and there's a variety of different steps to drive Lean. As goes with Six Sigma. Six Sigma, when we're looking at variation, an organization that is practicing Six Sigma means that it is extremely tight in its processes. So tight such that 99.72% of the time, the outcome of a process is exactly what they want. Consider that. What kind of process 99.7% of the time is accurate? Do you have such a process in your own organization? Now, you might think that that's very difficult to happen, but I'm going to share this quick video to show that, you know what, it actually is possible.
Mumbai has over 18 million people. The city, it's unpredictable. But amidst this chaos, there is one thing that is nearly 100% reliable. It's your lunch delivery. The Dabbawalas of Mumbai are an institution. A Dabbawala is a guy who delivers homemade lunches.
मेरा नाम किरण गवांदे है और मैं डब्बावाला हूँ। बिजनेस में ज्वाइन किया और तब से मैं 12-13 साल से काम कर रहा हूँ। खाली बॉम्बे में ही हम रोजाना 2 लाख डब्बा पहुँचाने का काम, खाली साइकिल और ट्रेन ये दोनों चीज़ों से मिलके डब्बा पहुँचाने का काम करते हैं।
This is how the system works. The Dabbawala comes to your home and picks up your lunch. He goes to the train station where all the other lunches are. They are sorted and then delivered out into the city to be dropped off at your office. You eat it, the Dabbawala comes, picks it up, and brings your lunchbox back home. That's the key word, home. These aren't takeout delivery guys. They're delivering you a meal straight from your kitchen. This system, while seemingly rudimentary, has been recognized as one of the most efficient logistics systems in the world. Dabbawalas have an accuracy of 99.99% in their deliveries. Per million transactions, less than 4 mistakes are made.
तो सबसे इम्पोर्टेंट चीज़ होती है कि जिस डब्बे के ऊपर जो कोड होता है, कोड में क्या होता है कि मतलब कुछ आंकड़े डाले जाते हैं, कुछ कलर कॉम्बिनेशन होता है। गलती मतलब कि कोड डब्बे के ऊपर इतना परफेक्ट डाला हुआ है कि उससे गलती होने की कोई संभावना ही नहीं है।
Crisscrossing side streets on bikes, balancing trays that weigh almost 150 pounds on their head, this group of 5,000 men, they help define the city.
बॉम्बे में कम से कम उसको 125 साल हो गए। ये सिस्टम और किसी दूसरे जगह पे नहीं चालू। थोड़ा सा हार्डवर्क तो है, तो आदमी मतलब थोड़ा सा थकता है, लेकिन क्या वो अगले दिन वापस एक नए जोश से स्टार्ट हो जाते हैं।
These guys are out there 6 days a week, monsoon or shine. Life in Mumbai, it can be chaotic. Your train might be late, your power might go out, but damn it, your lunch will be on time.
So, just kind of highlighting how it's a very simple type of process. Simple in the sense that it's a basic process, but it has a lot of different variables in it. And using tools and philosophies from Lean Six Sigma, like visual management, for example, can very much improve a process and make it a lot more rigid, make it a lot more consistent. These are very basic tools that we hope that you can get a grasp of today and start to apply in your own organization. So, how do we start to approach problems when it comes to a quality improvement methodology? These are the 5 stages of solving a problem that we're going to be talking about today. It's called DMAIC, and it stands for Define, Measure, Analyze, Improve, and Control. These are the 5 stages that we recommend projects or improvements go through to actually make a difference. The first phase is define. It's all about trying to understand what is the problem that you are trying to solve. Now, this might be a very basic question, but if you've worked on many projects, you realize that depending on the people who are attending, each person might actually bring their own perspective on what that problem is. So it's very important to understand upfront, what is that problem? What is your goal with this project? A very powerful tool to do that is this concept called Gemba. Gemba is a fancy Japanese word for the actual place. This is where the work occurs. This is the shop floor. This is your pharmacy floor. This is where the problems are being experienced. So we encourage people to go to Gemba, go to where the work is being done as a way of learning what the problem is, interacting with people to understand a little bit more about the problem and start to collect a little bit of data on that. This data can then be used towards the measure phase. The measure phase, we're starting to collect information. You might be talking to people and collecting a lot of data to look at what are some of the trends. What is causing this big problem? What are some of the big contributing factors to this big issue? One such tool that you may use in this approach is a value stream map. It's a visual tool to show what is the process that is being followed right now. And that allows you to start to create, understand what is happening, how long this process is taking, and ideally, what are some of the opportunities or the contributing factors to this larger initiative. Now that you've identified what those contributing factors are, you can move into the analyze phase. The analyze phase is all about saying why. Why are these factors occurring? What is some of the root causes beneath the surface that are driving these issues? Because many times what you see on the surface is very different from what is actually causing the problem. And so you might use tools like a fishbone or a 5 whys or an FMEA or graphs, data graphs to really understand what the root cause is. One such tool that we use to help analyze a process is looking for the 8 wastes. The 8 wastes are 8 common things that occur in any type of process. And these are the things that we want to remove from our process because it doesn't add any value to our process. The good acronym to use to remember what these 8 wastes are is called downtime. It stands for defects, overproduction, waiting, non-utilized talents, transportation, inventory, motion, and extra processing. These are the 8 things that we want to stop doing in our processes. Now that you've understood what the root causes are, some of the big issues that are causing the big problem that you are facing, you are now in the position to make some improvement. What are some of the things that you can start to do to make sure that this process is improved? How do we eliminate those root causes? So whether it be error proofing, visual management, sort of looking at a concept called 5S, these are all different tools that you can use to improve your process. The last phase of the problem-solving process is the control phase, the very important one. Because in the improve stage, you started to run experiments, perhaps you've made some tests and some changes, and you've seen some impact. You've seen a change in behavior or a result in your hard work. Now we have to make sure it's sustained. What are some things that we can do to make sure that this improvement that you made sticks? And 6 months from now, this problem isn't coming back again. This is what we talk about in the control phase. So over the course of the next few slides now, I'm going to highlight what are some examples, some case studies where the same approach, the same DMAIC approach has been used to solve problems that maybe you face in your regular day-to-day world. This is an example of one where the medication errors in a long-term care home. There was an organization that was seeing a 62% increase in medication errors. And so they used the DMAIC approach to understand why is that actually happening. So they collected a lot of data over the past few months, and they started to see an average of 14.6 errors per month. So you can see that there was a large peak in the month of March, and it started to go up and down. So they really took a look at that data, and they found out that of medication errors, the biggest reason for that error was missed medications at supper time. So based off of that, they started to look at what's going on, what are some of the biggest issues, and they found that missed doses and wrong doses are the 2 biggest contributors to that. So they asked their question now into the improve stage. They said, what are some things that we can do to make it easier for people to not forget? And they came up with a variety of solutions, such as color coding their medication sheet and redesigning the way that medications are placed in their tray as a visual indicator to the ones that are put on an angle represent the residents that actually received their medication, and the ones that are flat are the ones that didn't. So it's a nice visual reminder to say, okay, who still needs to get their meds? And by doing these simple changes, you can see that they went from 14.6 errors to 3 errors per month. The next example here is around refilling compound collandine liquid, and I'm going to hand that off to Ina to talk a little bit about.
Great. Thanks, Ali. For this second case study, I'd like to share a story from my experience as a pharmacy manager, where I had just begun a new role at a pharmacy. A young child had been receiving refills of compounded clonidine from the pharmacy for quite some time. After receiving 1 dose of the most recent refill, the child became extremely drowsy and unstable. The child was taken to the hospital, where it was determined they were likely presenting with clonidine toxicity. As a pharmacist and as a parent, the feeling was overwhelming. I needed to find out exactly what had happened and to ensure it never happened again. Questions that Ali has talked about so far came flooding forward. How do I approach the problem? What can I change? What resources do I have? What's within my control? And how do I create an environment of continuous quality improvement? So let's talk about the answers to some of those questions here. The Canadian Incident Analysis Framework gave me a place to start. The steps in this framework helped me to formulate a plan moving forward to improve the processes within the pharmacy and ensure patient safety. The first step in the framework is to provide an immediate response and patient support. I provided all the information I could to the parents and the physician to support the patient's recovery. An initial review of the calculations and weights did not reveal any obvious errors. We needed to dig deeper to see what happened. While we did this, we outsourced all compounding for children and any compounding with a narrow therapeutic window to an external compounding pharmacy. The next step was to conduct an investigation, which included an audit of the weight of the clonidine that we had on hand, a review of calibration records, all compounds prepared over the periods of days before and after, and finally, a review of any other incident reports. Step 3 of the framework is the employee management part. This was a critical step. The pharmacy had been compounding for many years, and I was a brand new leader. Safety culture was a key focus through my whole process. Step 4 was analysis and quality management. An analytical assay of the compound later revealed that the preparation contained 10 to 14 times the labeled amount of clonidine. And step 5 was to follow through and close the loop. So on the next few slides, we're going to talk about what follow through and closing the loop means. So the incident analysis revealed 5 contributing factors or gaps. First, there was an inadequate standard for a final check process, which should have included a process for an independent double check by a pharmacist or a regulated technician. The key contributing factor which resulted was the incorrect reading of the clonidine weight by a non-pharmacy registrant, which resulted in missing the decimal point. Second, there was incomplete documentation of the clonidine compounds, which made backtracking of the steps somewhat challenging. Third, a culture of safety was not well understood by the staff to facilitate reporting of errors and focusing on designing safe systems to ensure that the risk was reduced. Fourth, there was a lack of policies and procedures which did not incorporate the NAPRA model standards. And finally, a lack of familiarity or training such that 2 different staff members were preparing the compound in different ways. Now that I understood what had happened, I faced the questions that many of you have probably also faced, which is how do I make the changes to the process to ensure safety moving forward? So, as I mentioned earlier, our immediate response was to outsource all high-risk compounds. So how did we close the gap? And when I say we, I do mean we. I mean the whole pharmacy team. So the first step was growing a culture of safety through education with the pharmacy staff. A discussion on the incident was conducted, education on changes and policies and procedures, and safety huddles occurred. We also identified training opportunities and conducted regular skills assessments for staff on high-risk processes. Next, we designed a system whereby a pharmacist performed the independent double check for the API ingredient and the CAS numbers. That included the weight verification and compounded calculations. We used technology to reduce the risk of another error or confirmation bias when reading the scale. We purchased a weigh scale. Next, thanks. We purchased a weigh scale that printed out the weight of the ingredient to be included as part of the prescription documentation. Next, we designed a compounding area to minimize the distractions to the pharmacy staff. And finally, policies and procedures were created, which included the NAPRA model standards for compounding. So you may be wondering, did those changes have an impact? How did the steps so far consider the Lean Six Sigma process or approach? And how was I able to make the changes with the limited resources and financial resources that were allotted to me? Like many of you, the pharmacy was very, very busy and we were determined to find a way. I can tell you that the system changes we implemented created safeguards and opportunities to catch potential errors. Potential incidents became good catches which showed me that the safeguards were working. With the standardized policies and procedures, we gained efficiencies in time, which supported the independent double checks by the pharmacist. We experienced less product wastage by detecting the errors before compounds were made, and therefore less write-offs. We started to save money. With a focus on safety culture and training, an environment was created where staff felt supported and stayed long term. These changes led to a reputation in the community as a pharmacy that cared, and the business thrived because we did the right thing. The challenges in the short term led to improvements in the long term. And finally, everything I've talked about so far was about improving safety at the local individual pharmacy level. But reducing the risk of recurrence is more than just about one pharmacy. It is about ensuring other pharmacy professionals learn from the error as well. I go back to the learn, share, act cycle that we spoke about earlier. Well, when the power went, when the presentation went down, but in the learn, act, share cycle, at our pharmacy, we learned what happened and how to make improvements. It's important for me to share this learning with community pharmacists and technicians in this ISMP Canada Safety Bulletin in the hopes that then they would review their own processes to identify the potential gaps and implement their own system changes to keep children safe. Thanks, Ali. Back to you.
Thank you. So hopefully you've started to see how powerful a continuous quality improvement framework can be. The question is now, how might you actually make this type of change in your own organization? How do you start to create a culture of continuous quality improvement? Well, to do that, we're recommending four components. The first is a strategic alignment, creating some sort of strategic alignment. The second is to create some sort of cadence on improvement initiatives, then to incorporate improvement into daily work, and then to work on your capabilities. These are, start to notice, you're starting to tackle improvement at different levels, from the strategic level and saying what your goals and priorities are, and then using key projects to drive that, and then incorporating it into making it part of everyone's day-to-day work, and then building the training and the capacity of each person. One way of building that capacity is by focusing on training, and that is through yellow belt or green belt level certification. Yellow belt training is great for someone who wants to be an active participant, typically performed over one day. This one-day session will give people a strong understanding of what some of the fundamental tools are, and they'll be able to be active participants in future projects. Green belt traditionally is a much longer multi-month process where it's designed for people who actually want to lead improvement initiatives going forward. They want to be the facilitator at the front of the room. If this is of either of interest to you, we encourage you to reach out to us and we can guide you on some future events. With that, we're basically done for today. I appreciate everyone's feedback here. We're going to be sending out a survey very shortly to you. We would really like to hear how you felt things went today. Again, apologies for the technical issues here, but we really want to know what your thoughts are. We really would love for you to kind of fill in the survey when it is sent to you. But I'm going to open things up to see if there's any questions, perhaps, in the chat window. If there's any questions, I don't see anything right now. But in summary, if there are any questions, feel free to please put them in the chat window. But in summary, you can realize that CQI is a very powerful approach to driving improvement in your own organization, and there is a structure to driving CQI using the DMAIC approach. And the ISMP Canada and the Value Collaborative, we have a long history of helping organizations like yourselves along all steps of the journey. So with that, We are done for today. Again, I want to thank you for listening and attending. Up again, apologies for the IT issues. If you have any questions, feel free to put them in the chat window now, or you can email us at education@ismpcanada.ca, and we'll be happy to respond. Thank you, everyone.